not get tripped up over it. Don't get tripped up over a flat tire, or someone flips you off, or the casserole doesn't turn out. That's my normal. That's my kids. Don't get tripped up over things. Honestly, when you're presented with a situation, and I kind of thought I was pretty intentional going into this, but now every thought I have is basically stopped in slow motion, right? My arm to tell it what to do, to tell it to grab something and to bring it to my mouth, or that where does this belong in space, or the leg, or my brain as people talk to me and I have to really focus on what they're saying and then interpret it and then come up with a logical reaction to what they're saying is a lot of work for me. It's a lot of work. I never appreciated it before. People would talk to me, I'd fire right back, you know? Now people talk to me and I really have to stop and listen and take it in and go, okay, that's what that means. This is what I say. And I know that it's gonna get better. They all say it's gonna get better 100%. And it will. It's just gonna take a lot of effort and a lot of time, but I have a heart of gratitude. I am so incredibly blessed. As I sit here and I look out, I have amazing friends. The love that I have from people and the kindness, the texts, it just brings me such great joy and such great love and gratitude for people. It really does strengthen my resolve to continue to give back, to send the texts of love to people that need it. That's what it's about. We are in this thing called life together, and it's so not about the things that we think it is sometimes. It's really, really about loving one another, taking the time to share our love, taking the time to go the extra mile to make this day better because you're in it. I never knew I had a brain tumor. As I look back, people say, oh, did you know? It was a very large brain tumor. How could you not know? How could you not have headaches, right? Or how can you not have personality changes or whatever? I did have a clue. Not that I had a brain tumor, but I looked back and I was nauseated. I had bouts of nausea. The last 8 weeks, I had bad bouts of nausea, acute, boom, stopped me in my tracks. Talking to Addie, and all of a sudden, oh, gotta lay down. I laid down, it wouldn't go away, right? But you think, oh, must have just been that cheese pizza or ice cream. But yeah, that's my struggle now, is nausea. But again, I don't really want to talk about myself. I just want to give hope to others and know that whatever situation you're experiencing, whether it's COVID, whether it's a loss of a loved one, whether it's an acute sudden seizure in the middle of the night by yourself in the middle of nowhere on a hotel floor, whether it's a divorce, whether it's a child having a health issue, whether it's a loss of any kind, a betrayal of any kind, or setback of any kind, you have choice. You have choices. Those crossroads, moment of time, it's your decision to make a decision of how am I going to react, or how am I going to handle this, or how am I going to accept this? That's your decision to make. I'm in the middle of this, right? I'm not cured. I have a left side that doesn't work like I think it should. But you know what? It's all right. I'm good. I'm great. Because this left side's gonna end up being 1,000%. And even if it isn't, totally fine. It is what it is. I have my head shaved like this, and I gotta wear these headbands. But you know, I don't really care. I'm alive. And my grandbabies are being born in August and October. And I'm gonna see them and hold them. Thank God. Thanks for listening to me jibber jabber. Like I said, it's my month anniversary, so. All right, I'm gonna be done. But people ask how I'm doing. And it's kind of a complicated answer because there's so many layers to it. There's brain layers, there's stamina layers, there's functional layers, right? But honestly, I am doing so amazing. I am doing amazing. I'm so thankful. So thank you for listening. Make this day better because you're in it. Thanks. Oh, you know, there's one more thing I was just gonna say. This is for people that know of somebody that had a brain injury or works with people with brain injuries or, and this is definitely gonna make me a better PA, for sure. But there's some things you have to, maybe I would suggest understanding because it's really important. So people that have had issues that, especially with brain surgery and everything that goes into it and the rehab, I understand not all tumors are created equal and all rehabs are not created equal, but if and when you go see somebody in the hospital that has had any issues with their brain, meaning concussions or head trauma or brain surgery, I say the first thing is speak very quietly. Again, I say this as somebody who rounds on patients who's had brain surgery, and I go, oh my gosh, I don't think I did as good a job as I could have. Maybe I went in too perky, and maybe I went in a little bit too excited. So all you clinicians and caregivers, when you go in, gently touch their leg, their lower leg, and look at them and say, good morning, very quietly. Because that whole loud sensation is sometimes too much. So that's something that I really have a difficult time with, is a lot of loud noises. But yeah, so that's something I would really consider suggesting. And then speak kind of slow, not like offensively slow, but maybe slow down the pace of the information you're giving them. Kind of like take it down a notch, I think would be the best advice, right? And then I think the last thing is just allow them to talk. And I certainly don't expect people to get it. I don't expect people to understand. Certainly, you know, firsthand, it's I thought I understood, right? From a clinical perspective, I can tell you this and this and this and this and this to be discharged from the hospital. But there's so much about allowing somebody with trauma, especially trauma in a situation like I experienced, but just allow them to talk, because that's, I think, really healthy. And that's something that I'm finding that I really do appreciate about my interactions with other people, is just allowing this experience to have a voice. So for those of you who've had trauma or have gone through, probably not even brain surgery, but anything of this nature, find somebody that will allow you to share. I think that will really be helpful for you. All right, I think I'm finished, so have a wonderful Wednesday.